Good evening. My name is Karen, and I'm the Community Education Coordinator for Boulder Community Health. Welcome to tonight's lecture on Advanced Care Planning. The lecture portion for tonight's program will last about 45 minutes. Afterwards, we'll use the remaining time for questions. Please type your short general question in the chat box below the video on your screen. We'll take as many as we can. On behalf of Boulder Community Health, it's my pleasure to introduce this evening's speaker, Dr. Barry Platnick. Dr. Platnick is the Medical Director for Palliative Care and a Trauma and Acute Care Surgeon at Boulder Community Health. He is a board-certified in general surgery, surgical critical care, and hospice and palliative care medicine. He went to medical school at Oregon Health Sciences University, completed a surgery residency at Kern Medical Center, and his fellowship in trauma and critical care surgery at the University of Minnesota. After 30 years as a trauma surgeon, Dr. Platnick completed his Master's of Science in Palliative Care and his Hospice and Palliative Care Medicine Fellowship at the University of Colorado School of Medicine. Welcome to Dr. Platnick.
Thank you, Karen. And I'd like to thank Boulder Community Health for asking me to come here and speak tonight on a topic that I'm pretty passionate about, and I think that is potentially misunderstood by some, and certainly of importance to all. So let's go ahead and get started. I think the first thing I'd like to address is how did a trauma surgeon become a palliative care doctor? Most times people think of trauma surgeons as, keeping people alive at all costs, aggressive and fast moving. I am all that, and I have been all that for 35 years. I was the medical director for trauma at Denver Health and the surgical intensive care unit director at Denver Health. During my time as a trauma surgeon, one of the things that I came to recognize is that not everybody has the same set of goals. And unless we know what people's goals are, there's really not a good way for us to provide the care that you would want. It can be challenging. It can be challenging for medical professionals to understand what an individual might want. You know, when I was training, I was reading the book Being Mortal by Atul Gawande, and I would say I have to recommend that book to pretty much everybody. But during the same time, my mother-in-law, she got a head injury and she wound up on hospice, and she was taken to a nursing home on hospice. And at that time, she was not supposed to come back to the hospital. But of course, as happens, she fell at the nursing home, she broke her hip, and they brought her back to the hospital. She was very clear about her wishes, about not wanting anything aggressive done and just wanting to be made comfortable. Despite that, my wife, when visiting her, met with the orthopedic surgeon who told her that, in no uncertain terms, that she was not doing the right thing by not having her mother operated on. Needless to say, my wife was very distressed, and she called me. I spoke with the orthopedist. We had a meaningful conversation, and my mother-in-law was made comfortable, and her wishes were carried out. And I think that's the conflict is what we're trying to avoid. The tension is what we're trying to avoid, and providing care that's aligned with what you want is what we're trying to achieve. So what I'm hoping tonight is that I'm hoping that we can talk about what advanced care planning is and why it's important, what the documentation around that is, and how that records your wishes, really, if I'm going to impress anything on you, it's the importance of you choosing a healthcare proxy so that when push comes to shove, if you can't make your own decisions, there's somebody that you have chosen who can make those decisions for you. And then we'll talk a little bit about ways that you can talk with friends and family and healthcare providers about your future care. This is all, there's a lot of subjectivity here. It's not as clear cut as some areas of medicine. And if I'm going to stress anything, it's that the decisions that you make, the choices that you make are yours. They're not anyone else's. And you get to decide for yourself. It's important, though, that those are expressed and that we can understand them and that we know what you want. So what we're going to do here is what I refer to as a little bit of boring definitions, because I want to make sure everybody has the language, a little bit of nuts and bolts around this advanced care planning and advanced directives and so on. And then hopefully provide some real food for thought for you about yourself and what it is you might want. So, if you or anybody you know is planning on growing old, getting sick, or even ever dying, then hopefully this information will be of some value to you. One thing I really want to point out is there's great information on the web, and there's really great information at bch.org. The BCH Advanced Care Planning website is an extraordinary resource. It contains pretty much all of the documents you might need or want, explanations and links around the conversations that you might need to have. And I highly recommend that you look at it. I think once you sit down and take a look at it, if this is a topic of interest to you, which it probably is since you're here, you'll take a deeper dive. So what is advanced care planning? Advanced care planning is a process, and I want to stress that the planning is the process. What it hopefully results in is documentation and clarity for you and the people around you. It's designed, the process is designed to help you think about and discuss and document your healthcare preferences, and to make sure that your wishes are respected, especially if you can't communicate them. And the planning part includes documents like living wills, medical power of attorney, and most forms. And some of what I'm going to do is talk about what those are. So advanced directives are the documents that describe what it is that you have come to during your advanced care planning. A living will is a written document that describes what you would or would not want if you couldn't say so yourself. The MDPOA is your medical durable power of attorney, and that's who you want making decisions for you if you can't do so yourself. And I'm going to say this probably several times during the talk. Most of what we're talking about is if you can't express your wishes yourself. Obviously, if you can, you'll be the person that we in the healthcare profession are directly talking to about your care. So let me start with a case. The cases that I'm going to present to you are the names, ages, genders, etc. are changed to protect the innocent, but these are real life cases. Okay, so there's an 82-year-old man with multiple chronic illnesses. So he's got previous heart failure and COPD and diabetes, is found unresponsive at home by his neighbors. They're used to seeing him up and around with the lights on. They noticed nothing, that they hadn't seen him. And so they called the EMS, paramedics, who came to the house and found him in cardiac arrest. As they would do and will always do without other direction, they began CPR and the other measures to resuscitate and transport him to the emergency department. There were no advanced directives identified in the house. No most form, no Colorado CPR directive, no living will, and there was no medical durable power of attorney available. So he's taken to the emergency department. they begin their ACLS, or Advanced Cardiac Life Support Protocols per standard care. And the in-town family is notified and they arrive and they come to the emergency department shortly after the resuscitation begins, and they are, as you can imagine, visibly distraught. Unfortunately, they don't know what the patient's wishes are. And the family goes to the ER docs and says, you know, should everything be done? And of course, that's not the purview of the physicians. The physicians are there to do what the patient would want. And in the absence of knowing that, there are standards of care which state that we need to proceed as though we have permission to resuscitate the patient. The family, there was a little bit of arguing among the family about what should happen, and ultimately, and not long after he arrived, he was unresuscitatable and he died in the emergency department. So you can see why advanced care planning matters. If we don't know, we don't know. If your family members don't know, they don't know, and they don't have peace of mind. They can be conflicted, they can be upset, they can be confused, and they don't know how to respond in an emergency situation. The advanced care planning makes it so that your personal values and your personal beliefs and your personal goals are known and respected at times like this case that we just talked about. It's interesting because everybody's a little different. What we want, what you want, what I want, what my adult children want, it's all different, and it changes throughout life. Early on, a young person might say, if I can't ski bumps, I'd rather be dead. And later in life, I might just say, if I can sit in a rocking chair smelling my grandbaby, that's good enough. And so we all have very different goals. And as you can see here in this study, there's very different opinions about what is better, worse, or similar to being dead. Some people feel that being incontinent or unable to get out of bed or being a burden is worse than dying. Others, not so much. Everybody has different feelings about what levels of pain or disability they're willing to endure. And this, as I said, this changes throughout life, okay? And it's one of the reasons that I will stress that while the documentation is very important, the living will, most forms, et cetera, that we talk about, I think that one of the most important things is the medical durable power of attorney, because the documents are static. Okay, when you write something down, you're saying, this is how I think I will feel when the time comes. And if you have a person that you've designated to be helpful in that setting, that's somebody that you can talk to on a periodic basis, somebody who understands you, and somebody who can reflect about where you are now in your life and how your goals and wishes may have changed since you wrote those documents. So I just wanted to provide a little information here for you. In Colorado, we're doing pretty well compared to the rest of the United States. We have our older adults, thank you very much, myself. Our older adults are doing pretty well at their having advanced directives compared to the rest of the country. One of the things that I just wanted to point out, and everything I'm going to talk about tonight is with respect to Colorado. And so when I talk about the documentation and some of the Colorado law, if you're not in the state of Colorado, you'll need to refer to your own state law, but most of this will translate. But it's interesting, the things that affect all of healthcare access and healthcare equality apply to advanced care planning. And I think that's not a surprise to most people. As you can see, of course, women are smarter, as they typically are, and poverty level, education, race, all of these things play into it. This is a slide that I find very interesting. In Colorado, it doesn't matter if you're in good health, poor health, fair health, or excellent health. pretty much the same rate of having a completed advance directive. And I'm not entirely sure why that is, but I think, as you'll see on the next slide, I think part of it is a failure to reach out to patients during their healthcare journey and have them understand what the importance of these documents are. As you can see here, even patients who have, of the patients who have documented advance directives, close to 90% of them have talked to their friends and family about it. Less than 50% have talked to their healthcare providers. I think that's on us. I think part of that is us trying to figure out what are the barriers to bringing up that conversation. And my message here to you is bring it up with your healthcare provider, because it's your healthcare and you're entitled to have these conversations to better understand what your healthcare journey will look like and what is, and have them understand what's important to you. So a living will is a document that outlines how you want your healthcare managed in the event that you can't say it yourself. And the commonly discussed things are CPR, ventilators, pacemakers, internal defibrillators that shock your heart if your heart stops, and artificial nutrition and hydration. There are some requirements to having a living will in the state of Colorado. If you have DNR tattooed on you, that might be a way of communicating your wishes. It is not legally valid in the state of Colorado. You must be 18 years or older. Your living will must be witnessed by 2 unrelated witnesses, or it must be notarized. And if they are not notarized or witnessed, they would not be considered valid. So I'm going to go through a couple different kinds of living wills, if you will, or advance directives. The first is the Colorado CPR directive. And as you can see, the Colorado CPR directive is a document that is meant to be primarily is used in the outpatient setting, as is the MOST form, which we'll talk about next. So that if you're that 82-year-old gentleman we talked about earlier, when the paramedics arrive, if you don't want CPR, they would see that documentation, which is commonly on the refrigerator or the back of the front door. Those are the places paramedics will look for them. And they will not be compelled to do CPR on you. You'll notice that this needs to be signed by a physician. It's signed by the patient, it's signed by the physician. And it speaks only to CPR. In contrast to the Colorado Medical Orders for Scope of Treatment document, or the MOST form, or the green form, which is a form that addresses CPR, it addresses levels of medical intervention, and it addresses artificial nutrition. These can be signed by a physician, an advanced care practice nurse, or a physician's assistant. This is also a document that is most helpful in the outpatient setting. Again, when the paramedics arrive, they know what level of care you might or might not want. As this follows you, and should follow you, to the emergency department if you're brought in, it also informs the healthcare providers in the hospital setting as to how aggressive to be. So even if you don't want CPR, for instance, you still may want selective treatments, such as antibiotics or other less aggressive interventions. This is a generic Colorado living will. Excuse me, I'm gonna take a quick sip of water here. This is a Colorado declaration, which is a very standard sort of living will. You can see that it is requires a physician to declare you incurable. It talks about a very specific time frame that you would or would not want interventions, and when to terminate the interventions. And again, one of the things that I stress about these documents is that when you're filling them out with the understanding that this is how you'll feel at the time that this occurs. And these documents, once they're signed and dated, they're good until they're changed. So if this document was done in 1996 and now we're in 2025, some things may have changed. And so it's important that you update regularly your living wills and other advanced care directives. There's numerous living wills, and I'll show you another example. And then what we'll talk about a little bit later are some ways to think about this, talk about it, and work through it. This is a more nuanced document, something more like what we use here at Boulder Community Hospital, and it talks about terminal conditions or vegetative states, so not just a terminal condition. And you can have other directions that you attach to this, and so it's not just this document, but anything else that you may want to express. Importantly is this piece down here, which is what's called resolution with the medical power of attorney. One of the things that is true in Colorado is that the living will supersedes every other advanced directive. And so if you have a living will that says one thing and a power of attorney that says another, the law states that we should follow the living will. This here gives your power of attorney flexibility to say, yes, but, for instance, we just were talking, he never realized he was going to be this sick, and he doesn't or does want this. And I know it doesn't say that, but I'm his power of attorney and we've had these conversations. And it then allows for some flexibility with respect to a document that, as I said, is static. So this is a slide that I like to use for people who are in the room, but you're not in the room, so let's try it like this. Do you have a designated MDPOA? Just ask yourself, do you have a document with a medical durable power of attorney designated on it? If you don't, do you have somebody who would make decisions for you if you couldn't? So maybe you don't have the document, but you have somebody who can make decisions for you if you couldn't. That's all well and good. If you don't, is there anyone you wouldn't want making decisions for you? Is there an antagonistic family member? Is there somebody who you might say, you know, I'm not sure they would act in my best interests? So you need to think about that, because here in Colorado, we'll talk about the difference between a power of attorney and a healthcare proxy. Okay? MDPOA, you choose who makes decisions. Proxy is appointed by the healthcare team. The MDPOA is most likely to accurately represent your wishes. Okay? MDPOA is a declaration. It's a person that's identified by you to make healthcare decisions for you if you lack capacity. And the definition of capacity is something we can talk about if you put that in the chat. But it's really just, do you have the ability to make your own medical decisions? Are you responsive, conscious, confused, whatever? In Colorado, it does not require witness or notarization, so you just have to sign it. You have to, it says must be written, but it can be a pre-written form, but it has to be signed by you. And your MDPOA is only authorized to make medical decisions for you. And there's some confusion there sometimes because people think they can make financial decisions and they worry about that, and that's just not the case. It's also durable over time and circumstance. And what I mean by that is that the medical durable power of attorney, once you sign it, once you designate them, unless you change that, they can make healthcare decisions for you if you can't make them for yourself, in the hospital, out of the hospital, this admission, next admission, the other hospital, however it works. And so that's what we mean by durable. And the idea is they're making decisions for you that you would make yourself. And that's why it's important to have ongoing conversations with them. Proxy determination, however, in Colorado is a process guided by Colorado law. And so if you don't have an MDPOA and you come in and you're unresponsive or you become unresponsive in the hospital, it is the job of the attending physician to locate as many interested persons as practicable, which is what it says in the law. And it defines interested persons, as you can see here, which is pretty much any friend or family. So that group needs to come to consensus. And when they come to consensus, they will self-designate who's going to make the decisions. Colorado law, and this is the part I want to stress, does not recognize a presumptive proxy hierarchy. So unlike, for instance, New York, where there's the spouse and then the next of kin and then the next of kin, et cetera, there's nothing like that in Colorado. It is all interested parties get together and they self-appoint. And so if there are people that you wouldn't want involved and they can represent as interested parties, they will be involved in your healthcare decision-making if you can't do so yourself. And so if I stress anything tonight, it's get a designated medical power of attorney. The healthcare proxy is appointed. You do not get a say in who that is. They are only valid during this hospital admission. So unlike the durable part of the power of attorney, once they're appointed, it's only for this hospital admission. It doesn't work outside the hospital. And if you get readmitted, we go through the whole thing again. So how might you select your healthcare agent or proxy? And when I say this, this is from the American Bar Association, and that's why they use this language, agent or proxy. So substitute in their medical durable power of attorney, or MDPOA. Ideally, hopefully, you can come up with maybe 2 or 3 people who might be good candidates. And if you go through this slide here, it'll help you make the decisions. First of all, they need to meet the legal criteria, right? They can't be in kindergarten. They need to be willing to speak on your behalf. And they need to be able to provide what we call substituted judgment. In other words, they have to try to act as you would act. Say you were standing at the door looking at you in bed, how would you direct your own care? And hopefully they would do that for you. It's somebody that you trust. It's somebody you can talk to about sensitive issues. And somebody who's likely to be available into the future. And I think that's kind of code for not your like really elderly, frail parent. And somebody who can handle conflict if there's family members who disagree, somebody who's willing to either try to gain consensus or be willing to stand their ground for you in that situation. So let's talk about another case. Let's talk about a 76-year-old mother with 3 adult children. She has a giant stroke with a profound neurologic deficit. She's unconscious. She's on the ventilator in the ICU. She can't move one side of her body. She's fully dependent on life support. The teams reviewed her case, and she has essentially no chance for a meaningful recovery, according to that team. She has no advance directive, no living will or MDPOA, and she's got her 3 adult children. 2 of them live in town, and they've come into the hospital to see her. They let you know she's valued her independence and her dignity fiercely. She would never have wanted any of this, and they're planning to withdraw the life-sustaining interventions. However, at that point, the 3rd child arrives from out of town, just as the plans to withdraw life-sustaining care are to be undertaken, and says, absolutely not. Mom needs to be kept alive at any cost. She would preserve life over everything. Well, now there's a problem, right? We don't have a living will. We don't have a medical durable power of attorney, and we have dissent among the family. We have the interested parties at hand, and they need to decide among themselves who is going to make the decisions. And as you can see, if there were advanced care planning documentation in place, the confusion and conflict would be decreased or eliminated. The whole family benefits. The patient benefits, the family benefits, there is a common understanding. And when there is not that common understanding, everybody suffers. The patient, the family, friends, and the healthcare team, because there is moral distress among everybody in these kind of situations. So how do we go about doing this? How do we talk about these things? This is the Conversation Project by the Institute for Healthcare Improvement, and they have a great website. And actually, a lot of what's on the BCH website is from the Conversation Project, and they will walk you through a lot of it. So as you can see here, this is a starter kit that talks about the kind of things you need to think about and ask yourself and talk about with the people around you when making these sorts of decisions. What do I want? What do I not want? Who do I want speaking for me? What's important to me now? What do I think will be important to me in the future? What does a good day look like for me? You know, what is important for me to do? And the last slide, you'll see I've listed a number of resources, and you'll have that available to you after the talk. There are the websites, a number of websites, including the BCH website, which has very valuable information and step-by-step approaches to talking through this. One of the websites that I particularly like is called Prepare for Your Care, and it's prepareforyourcare.org. And you can see here, they go through this in a very stepwise fashion, and as you click on each one of these, it will take you through more and more discussion about how to choose a medical decision maker, deciding what matters most to you in life now. Because as I said earlier, we know that younger people have very different sets of goals and values to older people. Choosing flexibility for your decision makers. How do you do that? How do you empower your decision makers? How do you talk to others about your wishes? And how do you talk to your healthcare team about your wishes? Another thing that I think is very useful in this, and for some of you this may be the case, is you're looking at talking to other people about how they're going to navigate their healthcare journey. I can tell you that, like, for myself, right? I have older parents, and I'm the doctor in the family, and so we sit down and we talk about some difficult things as to what they would or would not want. And it's easy for me, but it might not be easy for you. And so this guide will help you talk about how to bring up the topic, how to ask other people about their wishes, and how to help them write them down. One of the things it's very important, we all know this, what we say and what we think can be fleeting, but once we write it down, we reflect on it. And I think that's important, especially for these kinds of things. So I like to put in this case because I don't know if there's any young people on the line, but it's young people are often feeling very invulnerable. And we often don't think that we need to think about these sorts of things for our kids. I have adult kids, so, and by the way, they have medical durable power of attorneys. So we've got a 23-year-old guy who was involved in a scooter crash. We all love the Lime scooters, but they are notorious. Please wear a helmet if you're on one. He had a severe traumatic brain injury with no chance for meaningful recovery. He's in the ICU. He's on the ventilator. He is on medications to support his blood pressure to keep him from having a cardiac arrest. And it's very clear from the imaging, the neurosurgeons, and the surgical intensivists that he has irreversible brain damage and will not recover any type of consciousness or movement. He has no advance directive, no MDPOA, or any documentation of prior healthcare preferences. This might sound familiar from the last case, because these are the cases that are difficult for us. So, as is true with a lot of young people, right? He lives with his friends. He's lived with his best friends for the past 3 years. They're there at the bedside. They were there when he crashed. They're there at the bedside. The roommates report that he doesn't have much contact with his parents at all. And they say they've talked to him a lot. And as many young people would say, He's told them, you know, man, if anything ever happens, I don't want any of that stuff, et cetera. You know, he's told them, I do not want to be in a dependent or vegetative state. If I'm like that, pull the plug, right? That probably sounds familiar, and that was what they related to us. So then the parents are finally notified. They arrive at the hospital before decisions are made. And as you can imagine, if you're a parent if you're a parent at all, but if you're a parent of adult children, you would have a very hard time. I would have a very hard time with these decisions. They insist that the life-sustaining treatments be continued indefinitely. At this point, they're like, we're not gonna stop anything. He's not brain dead, so we don't have, or dead by neurologic criteria. We don't have any reason to say we have to do it. And so now the best friends and the parents are in direct conflict about how to proceed. So who has decision-making authority, the friends or the parents? As you can see here, we have a very difficult proxy process in front of us. This is going to be a time where I think the palliative care team, our social work, chaplains, whoever is best at facilitating these conversations is meeting with this group of people and trying to help them come to consensus about what the best path forward is for this young man. I think we can all see that if he had designated a medical durable power of attorney or had written anything down, a living will, or any of his wishes were written down, that he would, his wishes would be followed, his goals would be clear. While there would be sadness, grief, and anguish, I think the conflict and confusion might have been avoided. So that's a lot of definitions and a lot of, a little bit of jargon, but hopefully I've clarified a little bit about what is and is not true about advanced care planning and directed you to some resources that would be helpful to you. And again, there's a resource slide at the end. So down and dirty, what advanced directive, if any, is right for me? Well, I would submit that if you're old enough to designate a medical durable power of attorney, in other words, you're 18 years or older, that you should have one. That everybody should have a medical durable power of attorney so that the person who's speaking for you in the event that you cannot speak for yourself is somebody you chose. If you want to have a living will, that's optional. I think that is a personal preference. If you're seriously ill, it's probably more important than to start having a living will, maybe having a most form, or some other written documentation to direct your care. As we get older, like it or not, these things become more important. Everybody needs a durable power of attorney. Probably should have a CPR directive if you have a thought about that. So if you do not want CPR, if you document that and have that on your refrigerator or the back of your front door, the paramedics will not do that when they arrive. And that would be in accordance with your wishes. If you're seriously ill and older, I think all of these things apply. You need a power of attorney, you need a most form, you need a living will, you need all of these things to help us provide care that is concordant with your goals and wishes so that you get what you want and you don't get what you don't want. So I want to thank you for taking time here tonight to hear me talk about these things that I am, if you can't tell, pretty passionate about. I think it's going to be time for some questions here. And I'm going to put up the resource slide for a second, but you'll have access to this after the talk is over.
Dr. Platnick, that was very informational tonight. Thank you for your presentation. We do have a few questions. We want to remind our audience that now is the time for questions, and please put your short general question in the chat box below the video on the screen, and we'll get to as many as we can tonight. And these are in no particular order. If an MDPOA makes a medical decision that has financial implications, how does that work?
That's a great question. The medical durable power of attorney is going to make healthcare decisions only, and they will do that typically without regard to financial implications unless you, the patient, have talked to them about that. So for instance, I might talk to my medical power of attorney and say, I want this sort of care, but I don't want it for an extended period of time because I don't want to deplete my family's resources. I'm not sure that's what you're asking, but that's how I took that.
So did this compare, they wanted to know a little bit of a comparison of that to the general durable power of attorney as far as who oversees the financials?
Sure. So the medical durable power of attorney is different than general power of attorney. You can specify them as the same or different. I'm not a lawyer, so I won't get into too much about the general power of attorney, but the medical durable power of attorney is distinct if specified as such and in the documentation, and would only have responsibility and authority to make decisions about your health care. They could not make decisions about your finances in any way. A general power of attorney, as I understand it, can act in your stead in all affairs.
So we have a curiosity question here. In the case of the 23-year-old, they wanted to know the resolution. What happened?
So in the case of the 23-year-old, ultimately, and this was difficult. What happened was ultimately we met with the friends and the family numerous times, and as you can imagine, they were at odds. They were angry at each other. It was difficult to get them in the room together, but ultimately, I think that they were able to, for lack of a better term, come to peace with the fact that it really was it would be his desire to not have anything further done in terms of life-sustaining treatments, and those treatments were withdrawn.
Thank you. As a MDPOA, do you need to have the documentation on you when speaking to healthcare providers?
You do need to be able to bring it in. The patient can have it with them. One of the things that ideally we would have this nice tidy form, and it would be scanned into your medical record. You went over it with you took it to your PCP. They put it in our healthcare, your My Chart or whatever the healthcare portal you use is. But a folded up piece of paper that's a photocopy is good. In an emergency circumstance, we would honor a photograph on the phone until you could bring in the documentation.
Okay. Are there elder care resources in Boulder County that we might access for planning when we no longer are able to live independently, like a nursing home?
Yeah, so there's a number of resources, and I can't name them off the top of my head. What I would suggest is that you and your PCP talk about that. Most PCPs have access to social work or case management, and they have full lists of the resources. We at Boulder Community Health work with a lot of the skilled nursing facilities, long-term care, assisted living facilities in the area, but to get a list of them and to learn the nuances among them, I think I would recommend that you speak to the social worker associated with your PCP.
Okay. Where does the hospital ethics team fit into this topic?
Sure. The hospital ethics team can be contacted to consult on difficult situations in which the course of action is unclear and can help provide direction. So, for instance, if I'm involved in a case and there is an unclear path forward, medical, legally, or ethically, I would involve the hospital ethics committee to review the case, provide consultation, and assist me and my team in the decision making going forward.
As a part-time resident of Colorado, maybe about half-time of the year, are advanced directives important?
I think they're important for everybody, no matter where you live. What I would say is, depending on where you really need to look at, the local regulations. So for instance, here, your medical durable power of attorney does not need to be witnessed or notarized. In another state, it might be. And so I would suggest that if you're spending time in more than one state, that you make sure that whatever advanced directive documentation you have is compliant with those states.
What happens if you're a candidate for CPR, but you're outside your home? How would the responders know your wishes?
That's a great case. That's a great question. If you do not have documentation on you, in the form of probably in that setting some type of wristband, if you really were very serious about that, then they would be directed to go ahead and perform CPR in the outpatient setting. So for instance, if you're at the mall and you collapse and you're in arrest and a candidate for CPR and you don't have documentation with you or a person with you, then they would be directed to go ahead and initiate CPR. In that setting, you hope that there'd be you would be with someone, and that someone would be able to provide documentation or actually be your power of attorney. That is a great question, and it's a difficult situation to be in.
Okay. But Colorado law, it does default to try to
resuscitate. So the emergency, the pre-hospital providers, paramedics, and fire department have medical direction, and they have basic medical orders that they're supposed to follow for any specific illness or injury. So if they arrive at a scene, they assess the person, and based on their knowledge and their skill set, as well as predetermined orders from their medical director, they will then go ahead and do what they're instructed to do. And those orders will be informed by Colorado law.
Good to know. Thank you. This person is asking if they have adult children, but more than one, can they put them on the MDPOA? Is that a little bit risky? If they disagree, or that's kind of...
That's very common. It's very common. It's very common for your adult children to be your power of attorney, your medical power of attorney. You can also have more than one person on there, and you list them in order. So if, for instance, one is not contactable, you can do that. But it's pretty common for people as they get older to have, especially if you don't have a spouse or a partner, or if your spouse or partner is unable to act, or you wouldn't want them to be put in that position, it's not uncommon to have your adult children be your medical durable power of attorney.
Okay. Are the Colorado documents valid while traveling in another state? And is there a way, or what do you recommend as far as copies to have with you while traveling?
So again, I can only speak to how they are interpreted in Colorado. Commonly, I would say they would be respected in other states, but if the medical emergency is unusual, or there's any kind of conflict, then they would resort to their own interpretation based on their state law. I would say that if you're traveling and you're certainly somebody who is at higher risk for having either illness or injury, then having your documentation of at least your medical power of attorney would be valuable.
This person said that they're a little confused on how many documents there are for representing your personal wishes. They have listed some of what you did, CPR, ventilator, most, living will. Is that it? And do some of those overlap?
Okay, well, thanks for bringing that up. And as I was told earlier, before I started this talk, I can't refer to old slides, so I'm going to do the best I can. Advanced directives are documents that speak to what you would or would not want and who you would want making decisions for you if you can't yourself. They fall into two categories. The person who could speak for you if you can't, and that would be the medical durable power of attorney, and documentation of what you would or would not want. In the documentation of what you would or would not want category, there are living wills, which are documents that speak to those areas that you addressed, that you brought up, such as CPR or ventilation. But the document itself is called a living will, and within that document, you describe what you would or would not want. In Colorado, we have a couple of other less robust documents that speak to just pieces of that. One of them is the Colorado CPR directive, which is just a yes/no to CPR. And the other is the medical orders for scope of treatment, or the green document, which is a little bit more nuanced than just the CPR directive. I hope that answers your question. And again, I want to direct you to some of these resources online. It'll be very clear if you go to the BCH website what some of the differences are among these, or if you go to the Conversation Project or the Prepare for Your Care website.
Is that where you would find the forms yourself? You, during your presentation, have not mentioned lawyers hardly at all.
Yeah.
And so where do you go to get these forms?
Yeah, so none of these forms require a lawyer. I'll say that clearly, I'll say it again. None of these forms require a lawyer. If you are more comfortable reviewing them with a lawyer and having them as part of maybe a larger plan for your estate planning or your overall trusts and so on, I think that's very valid. But for the person who just wants a living will or a medical durable power of attorney, you can get those online. You can fill out the medical durable power of attorney and sign it, and it's done. You can fill out the living will and sign it and have it witnessed by two unrelated witnesses, or have it notarized, and it's done.
Is there a particular website, or is that?
The BCH website will have those forms, as will any of the others that are on this slide.
Thank you. You mentioned a wristband. What wristband are you referring to?
So I don't know if we have them in Colorado. In some states, you can have a wristband that is chipped, essentially that has something that can be scanned. So I have not seen them here in Colorado.
Okay.
But there are some states that have those. So that's something that I would say you would have to look into yourself.
Okay. So another out-of-state question. Someone from North Carolina that has documents that were executed there, would they still be valid here?
It depends if they meet the criteria. If they met the criteria for Colorado, they would be valid here. So for instance, if you had a medical durable power of attorney that was done in North Carolina, you did say North, right? Okay, if it was done in North Carolina or South Carolina for that matter, and you came here and it was written by you, signed by you, that would be good. If you had a living will that was completed and witnessed by two unrelated witnesses or notarized, that would be good.
Would you advise bringing copies of the living will advance directives to local hospitals so that the hospital could add it to their records?
If it's a hospital that you use, so for instance, if you live in Boulder and Boulder Community Health is your provider, and the Boulder Community Hospital would be where you would come if you were had an emergency, absolutely. And your PCPs can do that. If you bring them into their office, they can do that. I believe, and I'm not entirely sure, again, I would talk to them about this, but if you have MyChart, which is the portal for your healthcare with BCH, you can probably upload them to that.
We're going to try to get in a few more questions here.
Yep.
Are you aware of an app where these docs could be placed?
I'm not.
Okay.
But I'm sure there is one.
When you find one, add it to your presentation.
There's an app for everything.
There we go. This person has MS, and they're doing okay now. Mm-hmm. But if things get too difficult, can they let their doctor know their preferences?
They can, but if they need to be written down. They really do need to be written down. And I would say that while MS is very well controlled in many cases now, I would classify it as a serious illness with the potential for progression, and that having documentation of your wishes in the form of a living will, as well as designation, again, this is a broken record for me, designation of a medical durable power of attorney, somebody who knows you and has watched you over time, who could speak for you in your stead.
Okay. What are your thoughts about the person for your MDPOA living far away?
As long as they're reachable. So it's great if they're across town, but we have plenty of people who have, especially here in Colorado, where many of us have been for a lot of years. We've gotten older. We have adult children. And despite the fact that we want them to live here with us, they've moved to California or Houston or wherever they've moved to. They can still be a very effective MDPOA as long as they're reachable.
We have two more questions, then we'll wrap this up.
Not a problem.
Can you request that your medical team weigh in on your care? Because they're the ones that know your diagnosis, and you can also relay your personal requests.
Absolutely. Again, I want to stress that everything we've talked about tonight is in the event that you actually are unable to speak for yourself. So if you have thoughts and concerns about your care, 100% you should be having those conversations directly with your healthcare team. And ideally with the people closest to you that you would want involved in those conversations, so that if at some point you do become unable to be part of that conversation, they were there too. But no, absolutely, your healthcare team should be part of the conversation. And if you're trying to make heads or tails out of some of this, it's very valid to take the living will, download one, print it out, take it into your PCP, and say, can we walk through this together? And can you help me think about filling it out?
Good idea. Thank you. Should a person with early stage Alzheimer's have these advanced directives?
So should is a difficult word. These are all very personal decisions. I would say that early Alzheimer's can be expected to be a progressive disease, one that can progress to a point in which you are unable to participate in your own decision making. And so having your wishes written down, or somebody who can express them for you, is probably a good idea. If if having your care later in life guided by your wishes is important to you, then that would be the way to go.
Well, we have come to the end of our time. Dr. Platnick, is there anything else that you'd like to say to our audience before we end tonight?
I guess if I were going to say anything, I'll say it once again, which is that the documentation is great, but having somebody who you can talk to on a regular basis, who understands for you, understands your wishes, and has kind of gone through a little bit of life with you, is invaluable. And so, as I showed earlier in that slide, the down and dirty slide, if you're going to do anything, have a medical durable power of attorney. That's really it. And don't be afraid to talk to your doctors about it. You know, these can be difficult conversations. And so that's one of the reasons that these websites really kind of go piece by piece as to how to walk through talking to people about it. And so I would say, take a look at that. Become familiar with what the kind of questions are and have the conversation.
Okay. Well, thank you very much. And a recording of tonight's lecture will be available at bch.org/livestream. You will receive a post-lecture survey and link to the recording by email. Please take a minute to fill the survey out. Thank you for joining us and have a good night.